All right, time now here is 7:53. The American Cancer Society has estimated that more than 14,000 new cases of cervical cancer. Courtney standing by, finding out what we should look out for. Good morning.
Yeah, good morning. We are joined by Dr. Aisha Taylor. She is an OBGYN with Kaiser Permanente. Good morning to you, Dr. Taylor.
Good morning. Thank you for having me.
Absolutely. It's wonderful to see you. And we want to talk about this because January is Cervical Cancer Awareness Month. And we have a really good friend here on Good Day and CBS 13 who passed away recently. And after he was sick, he was very intent on making sure that people went to the doctor, got their screenings, know their numbers, because that's, you know, kind of what happens. These things sneak up on you. Cervical cancer screenings is one of those things that we women need to really be paying attention to.
Absolutely. And as stated before, the American Cancer Society did estimate 14,000 new cases of invasive cervical cancer will be diagnosed this year, and another 4,200 will actually die from the disease. So it's really important that we understand how it develops and how to take care of ourselves.
So what is cervical cancer?
So cervical cancer is when abnormal cells on the cervix grow out of control. And for those of us who don't know what the cervix is, it's the lower part of the uterus. The uterus is where the baby grows.
Yeah.
And so most cervical cancers are caused by a virus called human papillomavirus, which is contracted through intimate contact. But one thing to note is that not all HPV viruses cause cervical cancers.
Okay. Now, where screenings are concerned, how often should we be getting screened for cervical cancers? And have you been noticing any delays with screenings because of COVID?
So actually, a lot of patients were afraid to come in to the doctor's office. Of course, during the pandemic, they were afraid they would get sick. But I would encourage you not to put off any routine screening. We are all masked as well as our patients, and we are ready to take care of you. It's really important to keep up on your routine screening. So we recommend that women get screened every 3 years based on your institution guidelines. At Kaiser, we do screen every 3 years based on normal results. But if anything's abnormal, it's important to follow the guideline that your doctor has set up for you.
Okay. And you mentioned HPV. So there is a vaccination that's available. Who should be getting vaccinated against it?
So actually, if you're 45 years or younger, we encourage kids as young as 9 get vaccinated, because what we do know is that it can protect against the high-risk subtypes that can go on to cause cervical cancer. So it's really important that we prevent it at an early age, get vaccinated, and if you fit the criteria of 45 years or younger, talk to your doctor about getting vaccinated and continue your routine pap smear screening.
Absolutely. All right. Dr. Taylor, thank you so much for your time this morning. We really appreciate the information. We're going to link all the details so that you can get more details from Kaiser Permanente, from their website, as well as from their Twitter pages for both the Sacramento and the Solano County pages. Thank you so much again, and have a wonderful rest of the year.
Thank you. Take care.
All right.